Thank you for joining us on CBSN Denver. I'm Andrea Flores. Coronavirus is still so new. There are so many unknowns. That's why we've started a new segment here on CBSN Denver. It's called Q&A with Dr. Dave. CBS 4 medical editor Dr. Dave Hnida is here to answer your questions. Dr. Dave, a report came out last week saying the virus is mutating and could be more contagious. What do we know about this mutated form of COVID-19?
Well, it certainly was a scary report that when you really get down to the nuts and bolts of it, it is certainly not anything to panic about. What this report basically says is that there's been a mutation in the coronavirus, and that mutation has made it more contagious and more deadly. But the big thing you need to understand is all viruses mutate all of the time. This was a report that was not even published yet in a scientific journal, but wound up gaining just a lot of traction in the news as well as on the internet. But when people actually took a look at it, they said, you know, there's just no evidence that there is a new turbocharged strain out there that's going to wind up causing more damage than the one that we have right now. And gosh, when you look at it, the strain that we do have right now is scary enough, but you don't need to worry that things have gotten worse.
And the stay-at-home order in Denver and many metro area counties expired Friday, allowing some businesses to reopen. We know a lot of people are eager to do things like get their hair cut. Is something like that safe to do right now?
Well, I think that this really depends on you and the salon following certain guidelines, and the responsibility actually falls on both ends. And for the most part, I think as long as you follow those guidelines, you'll be in good shape. And those guidelines include things such as making sure that there is a limited number of people inside of the salon. Total should be 10 or less, and that includes staff as well as customers. There does need to be distancing. In other words, at least 6 feet between stations or chairs. There does need to be a limitation on how people get into the salon. In other words, no walk-ins. You really need to be able to wait in your vehicle, for example, and then get a phone call or a text saying it's A-OK, it's time to come in. You should be wearing a mask. The person working on your hair should be wearing a mask. However, it's really not that important for either person to be wearing gloves. That's really not something that's necessary in this situation. One other thought before you wind up going out to a salon to get your hair taken care of is you may want to use the restroom before you wind up going. Anytime you can avoid the use of a public or commercial restroom, that's always a wise thing to do. Otherwise, really follow the guidelines. You should have no problems.
And Governor Polis has said the next few weeks will be key in determining if restaurants and bars can reopen. Some businesses have defied state orders and opened anyway. What do you think it will take for the state to allow bars and restaurants to reopen eventually?
Well, you know, I know the target date for trying to get things open is the end of the month, and it's going to be kind of a tough one to really get to, and it's going to be really all about the numbers, all about the trends. Things are really going to need to be going downward in terms of the number of cases, especially now as we're doing an inching toward that reopening. I think the important thing for people to remember is that the experience that you had with in-house dining before coronavirus is going to be so different than what we wind up going through right now. You know, think about what things were like months ago. You'd wind up going to a restaurant, there'd be tables jammed together, people jammed together, and there would be just really no limitation on how much you could spend time-wise in terms of enjoying a nice leisurely meal. However, what the problem is with a situation like that is that when you take a look at the spread of coronavirus, it really is so much dependent on how close people are together and the amount of time they spend in a close proximity. So you got to think about how this is all going to wind up working out. You're going to need to see people that are spread apart. There are going to be fewer people doing the dining in. And I think as we grow closer to trying to get a full reopening, there's going to be some issues like, are people going to be wearing masks? I mean, you can't go out and eat with a mask on. And then who are you going to be allowed to eat with? Will it just be immediate family members? How close are others going to be with you? A lot of questions that are going to need to be answered before you wind up moving forward with a full-blown opening up of in-house dining.
And Dr. Dave, what do you expect to see as far as cases now that the stay-at-home orders have been lifted?
Well, I think you need to take a look at this from actually two angles. And the first is going to be the short term and the long term. I think right now we're seeing some things beginning to open. More and more things will open. And, very frankly, we're really very concerned about what's going to happen over the next 2 to 4 weeks. It is just something that I think has us all a little bit on edge as we open up a little bit more. But then you also have to take a look at the longer term as well. You need to kind of understand that this is not going to be a one-time, one-shot deal when it comes to things like social distancing and wearing masks and closures and so forth. Long-term, when it comes to pandemics, really, when you look at the history of them, they tend to be like waves. They come and they go. And so even if things go very, very well at this point in time, the big question is going to be, what are things going to be like as we move into the months ahead? Look at Spanish flu, 1918, one of the most famous of all pandemics. That actually came in 3 separate waves. It was in the spring, it was in the fall, and then it was winter into spring, and then gradually fading out as you went to summertime. So it really was kind of a extended 2-year period where there was waxing and waning, just like an ocean wave. You can expect the same sort of wave experience with peaks and valleys. We may wind up moving forward, but we may also wind up having periods of time where we need to wind up stepping back again into the restrictions that we currently have. Going to be a lot of peaks and valleys. And we need to just understand this is not going to be over with forever quickly. We just don't know how long it will take before we don't need to be concerned about this any longer.
Dr. Dave, thank you for all of that helpful information. We'll see you right back here next Monday at 11 a.m. as we answer more coronavirus questions. And to see all of our Q&A with Dr. Dave segments, just visit cbsdenver.com. We'll be